Well, one of the biggest mental health studies undertaken by government has been launched by the Health Minister. Almost half of all Australians experience some form of mental illness at some point in their lifetime. And this study aims to garner new information on self-harm and services used by people at risk of suicide. 17,000 Australians between the ages of 16 to 85 will take part in this study. Patrick McGorry is the Executive Director of Orygen. He joins me now. Patrick McGorry, what do you hope the government comes up with in terms of data?
Well, Laura, thank you. This is a very welcome step. The last mental health survey that we held in Australia was in 2007, believe it or not. And so we desperately need new data on the mental health status of Australians. There's mounting evidence that the mental health of Australians, and particularly young people, the teenagers and emerging adults, is getting worse. And this is actually a worldwide trend among young people. So this is a very welcome step, and the Health Minister and the government are to be congratulated for funding and moving this forward finally. I think it's very, very important. And I think, as Christine Morgan said today, who in announcing it with Greg Hunt, we'll get vital new information about recent impacts on mental ill health and mental health through bushfires and the pandemic. So it's very, very timely, very important. There are some issues that I don't fully agree with the design of it, I must say, but we can have some discussions with the government about that behind the scenes.
Okay, Headspace has been so successful. Beyond Blue, Lifeline, these bodies do some amazing work, but everyone can improve. Are they still fit for purpose, or will this data give us some information as to how they should be running in the future?
Well, I think we've already got a lot of really good information from the service side, and the Productivity Commission and the Royal Commission Victoria is about to report that the service system is still not fit for purpose, even though there have been oases and of very good innovation. But they're sort of still not resourced at the right level to meet the demand. Probably able to handle about a third to a half of the demand currently that Australians need to see.
How has the demand increased over the last year? Has it even surprised you?
Well, it's hard to evaluate because the accessibility of services has been a problem, hasn't it? With even though the government did a great job there by bringing in telehealth as well, so that's maintained things better than would otherwise have been the case. But accessibility is definitely a problem. There are waiting lists everywhere you look for entry level, even into primary care services like Headspace. Headspace, if you can get in, is tremendously helpful to young people. But there are significant waiting lists everywhere around Headspace. General practitioners tell me that they cannot access psychologists or psychiatrists. So the capacity of the system is the key thing. And the survey will actually show what the real level of need is now, and that'll help government in planning the services. And government's ready to do this, I think. We're getting signals that the May budget is going to be critical for investment and reform in mental health from the federal side, and at the state level in Victoria at least. Other states probably, not so much the case, but there's been a very serious redesign effort about to be revealed in Victoria from the Royal Commission. So I think Prime Minister David Coleman, the new Minister for Mental Health, Greg Hunt, Daniel Andrews, James Merlino, these are critical people now in moving us forward into a new era, and the survey is a very key building block here.
We need something big, don't we? All eyes on that budget too, as you say. Patrick McGorry,
Absolutely.
Thanks so much.
Thanks very much, Laura.